It wasn't too long ago that participating in a kickboxing class would have been unthinkable for Kathy Cosgrove. Her biggest fear wasn't a sucker punch, it was leakage.
I first noticed my incontinence when I increased my exercise, and it was basically in kickboxing classes and karate classes. Jumping jacks were impossible. I used to have to leave the floor during my kickboxing class because I was leaking, and it was anxiety, it bothered me, I got nervous about it.
So nervous, she talked with her primary care physician about options to fix the problem.
And I did not want to stop exercising. I was 45, 46 years old at the time, and I was like, this is crazy. I'm an active person, and I don't want to sacrifice this in my life right now.
Kathy's primary care physician referred her to Dr. Robert Ayer, Chief of Urology at Beth Israel Deaconess Hospital-Needham. He assured her that incontinence is common, treatable, and not just a condition of elderly patients.
A lot of women in their 40s, particularly after they've had children, do experience some loosening, if you will, or laxity of the pelvic organs, and they begin to experience leakage of urine when they cough or sneeze or exercise, get up out of a car or off of a chair, and this can dramatically inhibit their ability to get into an exercise program.
Incontinence, says Ayer, is a very common problem. It's estimated 1 out of 3 women over the age of 60 will leak urine, and about 24 million women of all ages will suffer from incontinence. There are several kinds of incontinence. The 2 most common are urgency incontinence and stress incontinence. Urgency incontinence is a strong message that you must empty your bladder and you can't get to the bathroom in time without leaking. Stress incontinence involves the loss of support for the bladder-urethra complex, a loss of normal support, so anything that increases interabdominal pressure, such as coughing, sneezing, or exercising, puts pressure on the urethra, and women will have leakage of urine, which is what Kathy suffered with before surgery.
Kathy had what's called a urethral sling procedure. It's considered to be a minimally invasive procedure in that it's a small incision we make in the vagina just near the urethra, and then a specially designed needle is placed through the skin that allows us to snap a little piece of Prolene mesh sling to it and to position it in place as a hammock under the urethra so that it re-supports the angle between the bladder and the urethra, so that activities that do increase the intra-abdominal pressure, such as coughing, sneezing, and exercise, no longer allow the urethra to lose its support. This procedure generally takes 20 or fewer minutes to perform as an outpatient. It's a very quick, simple procedure with a very, very high success rate associated with it.
The recovery, I would say, was like 3 or 4 days. I mean, it wasn't really anything. And I noticed it immediately. I can do 50 jumping jacks right now and like nothing. It was amazing. I was really, really happy. When you live with something like that for years and you try to make changes in your lifestyle to accommodate not having an embarrassing accident, which is basically what I was doing, it just made everything about my life and my exercise goals, like worry-free. I would definitely recommend it. When I left his office, I grabbed I think I had a follow-up with him afterwards, and I grabbed 6 brochures. I mean, I've been at parties on a Saturday night sitting in the corner talking to women like, you guys got to get this done. Like, don't live like this. It changed my life. I mean, it really did. The surgery changed my life.